Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
We're back with another episode of the Healthy Chicago podcast. I'm your guest host today, Dr. Alex Sloboda. I'm the Medical Director of Immunizations and Emergency Preparedness here at CDPH. And today we want to talk about all the new updated vaccines that are coming out this fall to cover things like COVID, flu, RSV, and we'll talk more about what those are. We want to kind of give you all a glimpse into those things, what recommendations public health has, and how Chicagoans can protect themselves from these viruses and stay healthy and happy this holiday season and spend time with their family and friends. So today I have a wonderful guest with us, Dr. Jackie Tiema-Massie, and I'll let them further introduce themselves.
Awesome. Thank you, Dr. Sloboda. So hi, yes, my name is Dr. Jacqueline Tiema-Massie, and for the last 3 years, I've been serving as the Chicago Department of Public Health Immunization Program Director. So very happy to be here with Dr. Sloboda today.
Excellent. Yeah, we're happy to have you. So a lot of people are asking and want to know, where are we at these days with COVID-19? Is this something people still need to worry about in Chicago?
Yeah, for sure. So COVID is still here. Just like the flu, we don't expect it to go away. Over the summer, we saw some spikes. Many of you all may have contracted COVID or had family members or friends that also contracted COVID. Early in the fall, there were also several waves, including in September. However, currently right now, the current test positivity for COVID is somewhat low, but we do expect to have, COVID throughout the respiratory virus season, and we want to do our best to protect ourselves. So I know we're going to be getting into that a little bit more.
Yeah, definitely. Yeah, especially in the winter months when people are indoors, spending time together, not as outside as much. Definitely environment for like different viruses like COVID, flu, RSV, for more people to get infected. So yeah, we definitely want to talk about how to keep people safe. So I heard there's some updated vaccines this season for 2024, 2025 for both COVID-19 and flu. Can you tell me a little bit more about those and who should be getting them this fall?
For sure. So in June, the Advisory Committee on Immunization Practices, which is a group through the CDC that recommends the vaccines that come to market, recommended the updated 2024-2025 COVID-19 vaccines and also the flu vaccine in late August. Also, the FDA authorized and approved both the Pfizer and Moderna versions of that COVID vaccine, as well as the Novavax vaccine. So there are 3 vaccines that are approved to be used this season. And so following this, all of those vaccines became available at clinics and local pharmacies and just nationwide. So CDC is currently recommending that persons 6 months and older get the COVID vaccines and then also the flu vaccines to stay safe this season.
Awesome. And then what's different about like these COVID and flu vaccines that are coming out? Like, why should someone that have gotten COVID vaccines at the beginning of the pandemic or even last season, like why do we want everybody to get these new updated vaccines?
So the vaccines are new to protect us from the current strains that are circulating right now. So that's the same for COVID and then also for flu. So we monitor, what strains are circulating, and then new vaccines are produced to protect the general public annually.
Yeah. So these are, a lot of people are calling them boosters, but they're really updated vaccines, very similar to the ones we've gotten previously, but they've kind of just tweaked them a little bit to make sure they're protecting, because fortunately COVID-19 is like constantly changing, and there's always new strains all the time. So it sounds like they changed these the COVID-19 vaccine to make sure it's protecting against what's going around right now. So it sounds like everybody 6 months and older should get these new updated COVID-19 and flu vaccines. But where can people in Chicago get them this fall and winter?
Yeah, so this fall, if you are insured, you're being encouraged to go to your regular doctor's office or local pharmacy to get the updated COVID-19 and flu vaccines. You can also visit vaccines.gov or vacunas.gov if you're looking for a Spanish resource on where to find a provider. But if you're uninsured, the Chicago Department of Public Health is hosting a number of clinics. We started those in the month of September, and those will be going on through December. And so if you're uninsured, you're free to, come out to any one of our city-sponsored events, and those will be going on through the early part of December. So if you want to get more information on where you can get vaccine, please visit chicago.gov/covidvax, and you can also call our CDPH Community Health Response Corps hotline at 312-746-4835. And I should also highlight that if you're at risk of severe, impact of COVID or flu, and those are those that are have chronic health conditions or those that are over 65, we also encourage you to make sure you get the COVID and flu vaccines this year.
Yeah, for them, it's like super important that they get these new updated vaccines to stay protected against the current strain. So yeah, I know there's CDPH and the Immunizations Program are doing a ton of events, like starting last month, this month, through the month of November. What kind of sites and throughout the city of Chicago are these events being hosted at?
Yeah, great question. So we're hosting over 140 events. We're going to be at a number of aldermanic locations, I believe about 47 of those. We're also hosting events at 7 city colleges. So the first one kicked off at Kennedy King last week, and then this week we're going to be at Arturo Velasquez, and those will also be ongoing through the month of November. We're also partnering with our faith-based community to also do events at local houses of worship, and we did a number of events that were senior focused, but those ended in September. But again, if you're a senior, you're welcome to come to any of our ongoing events. We've also partnered with our Healthy Chicago Equity Zones to host pop-up events in some targeted communities around the city of Chicago.
That all sounds great. Obviously, that's where CDPH is trying to fill a gap, is making sure people that are underinsured or uninsured have as much access and availability as possible to get vaccinated. But I think from all these events, it doesn't matter if you have insurance as well. You're still welcome to come to our events and get vaccinated for free. So definitely take advantage of all these opportunities. Like you said, it was over 100, 140 or something.
Over 140 events.
That's awesome. So lots of opportunities. So yeah, at our website, we have all the listings of all those, and they're at many different locations literally throughout the entire city of Chicago. So
yeah, and I appreciate you highlighting that it's free. So it's not only free, but walk-ins are welcome. And as you mentioned, definitely go to our website again at chicago.gov/covidvax to register to attend. We're seeing an uptick in registrations, which is exactly what we want. We want the public interested in these vaccine events. And so it's likely that some of them can be full. So you want to make sure that you go ahead and register to make sure that you can reserve your spot.
Yeah, I've been to a couple of the ward events as well as at Kennedy King. And yeah, it definitely makes it quicker if you register ahead of time because you fill out all the forms and paperwork online, so it's a lot quicker. But definitely, if you're walking by or don't have time to sign up beforehand, still come to the event, and we'll get you through quickly. So, that's all sounds great. And you talked about some community areas that we're trying to focus on this season as well. So I kind of wanted to get a bit into vaccinations and health equity. So I know our epidemiologists or vaccine preventable disease team at CDPH did some amazing work and really looking at the data from the past couple years about different community areas, particularly those that are predominantly Black and Latinx, that have been most impacted by COVID-19 and flu, whether that's hospitalizations or ICU admissions or even mortality and death, because we know it's less frequent, but people are still passing away from COVID and flu to this day. So yeah, the team looked at all the data and identified a few community areas in the city of Chicago that we wanted to put a little bit extra emphasis on and get the vaccinations to those areas that have been most impacted by COVID and flu. And also in recent years, the vaccination rates in those areas have been a little bit lower than kind of the general population throughout the city of Chicago. So why do you think maybe some of those community areas have had lower vaccination rates for COVID and flu recently? And what is CDPH trying to do this season to increase those rates to protect those communities?
Yeah, so that's a great question. I think in our 2023-2024 season that ended August 2024, citywide the rate was about 16.6%, but we saw in our Black and Latinx communities that rate was closer to 11%. And we know that there are many reasons as to why folks may not be coming out to get vaccinated, whether it's because of mis or disinformation or just trust of the medical system overall. And an area that we're trying to support is access. So making sure that vaccines are available. We know that we have some communities in Chicago that may be a little bit of a pharmacy desert or provider desert. And so that's one of the reasons why we're broadly providing access to the vaccine. So it's really important to come out now while we're hosting our clinics, just to ensure that you get, free access to the COVID vaccine. And so, as a result, we're employing a data-informed, strategy to identify the locations, as you mentioned. And some of those community areas, there are 5 that specifically that we're targeting include West Garfield Park on the city's west side, also West Inglewood on the city's near south side, Burnside on the far south side, Hermosa that's northwest, and then also McKinley Park. And again, as you mentioned, those communities were selected because of the impact of COVID and flu on their, local residents. So we're bringing additional resources to those communities to ensure that those residents have access to the COVID vaccine.
Yeah, that's amazing. So yeah, we're doing, it sounds like all sorts of things. We're having COVID and flu clinics throughout the entire city of Chicago, so everybody has access, but also kind of an equity approach. We're trying to push a little bit more effort and resources to the communities that need it the most. So just trying to make sure everybody gets covered. But no, that all sounds amazing, and hopefully we have some good success there. You mentioned the Healthy Chicago Equity Zones. Can you talk a bit more about that and how we're working with them on these kind of target community efforts?
Perfect. Yeah. So in the earlier part of COVID, we contracted with 6 what we call regional lead organizations that really know the landscape of their community, to also work with other community-based partners within that region to get out information about COVID and to really engage with the community organizations in that region, and then also the residents of that region to answer questions that they had about COVID. So we've continued that partnership. And what it looks like now, there's a lot of outreach and engagement that those regional leads do. They help us sponsor pop-up events. They also do canvassing. We're going to be hosting a few community forums where we just want to hear back from the community what their thoughts are in terms of hesitancy themes or anything else that the city can do to make COVID and flu vaccine accessible to those community residents.
Yeah, I mean, in public health in general, like community health workers and community-based organizations are so critical and a really crucial part of public health efforts. And so we're definitely want to do everything we can to engage with those communities, the organizations that do all the work in those communities, and really have the trust of the community. And like you said, kind of also like working with trusted messengers, because especially like maybe coming from like CDPH, people might be a little weary of our message, but if we can partner with people that the community trusts to help with vaccinations and keep everybody safe, that'd definitely be ideal. And then I know, so definitely with vaccinations, like you said, there's unfortunately a lot of misinformation, disinformation going around. And so messaging is really important when doing vaccination campaigns this time of year. Can you talk a little bit more about some different either like media campaigns or messaging campaigns that CDPH is involved with this season, and kind of what the focus of that messaging is?
Yeah, great question. So this year we're promoting Don't Miss Out, so that's our media campaign that you'll be seeing shortly. And pretty much it's just encouraging the public. You don't want to miss out on life events because of COVID and flu illness. And, as you mentioned, mentioned earlier, we're getting ready to go into the holiday seasons. And, we know we're going to be coming indoors because of the cold weather and being more around family and friends. And so we just want people not to miss out on those, life events and those gatherings. And so our media campaign just encourages that. Don't miss out so that you can, by getting your COVID and flu vaccine.
Yeah. No, I think that's great and really, I'm sure, connects with a lot of different people that, they want to enjoy the fall and winter, the holiday seasons. They want to go to events, whether it's like music or festivals or faith-based events and things like that, and also spending time with their friends and family and their community. And so obviously, but when you get sick, you might not feel up to doing that, and you don't want to get other people sick by going to those events. So vaccinations are kind of our best protection, particularly against COVID-19, flu, so that you don't get sick and you're not getting others sick, and you don't, like you said, miss out on these awesome events this season. So I know we've talked quite a bit about COVID-19 and flu vaccinations, but I know there's also some vaccinations and immunizations for RSV, which is another respiratory virus that's pretty common and affects a lot of people as well. And so I was wondering if you can tell us a bit more about what's available out there. I know for these vaccinations and immunizations, there's specific groups that should be getting them that get more impacted and get more severe illness from RSV. So can you tell us a little bit more about the RSV vaccinations and immunizations?
Yeah, for sure. So RSV, also known as respiratory syncytial virus, results in an estimated 60K plus hospitalizations for older adults. And it also has a significant impact on infants. It's the number one cause of hospitalization for infants. And so as a result, there are 3 groups that are recommended to get the RSV vaccine. And so that includes our adults that are 60 and over, pregnant women, and then also infants. So the products that are available. So for those that are 60 and over, that there's an RSV vaccine that's available. And it's, again, available for those that are 60 and over. It's called Arexvy or Arisvio. And it's for those that have certain risk factors that, are at risk of getting serious complications and getting sick with RSV. It's not like the flu and the COVID vaccine in that it's not annual. But so for adults who did not receive the RSV vaccine last year, so CDC is recommending adults 75 and older receive 1 single dose of RSV. And for adults that are 60 to 74, that they also receive a dose of RSV if you're at increased risk of severe RSV disease. So it's just 1 single dose of RSV vaccine for older adults. And then for pregnant women, pregnant people should get a single dose of Arisvio during the weeks of 32 to 36 weeks of pregnancy and during the respiratory virus season, or between September 1st through January 31st. And again, that's also a single dose shot made by Pfizer. And that vaccine is meant to protect babies from RSV during the first 6 months of life. And so the mother is able to transfer immunity to their unborn child.
Exactly.
And then the last one is RSV product. I don't know if you want to kind of highlight that one.
Yeah, sure. So, that all sounds great. The last one, it's actually not a vaccine. It's an immunization because it works a little bit different. But it's called nirsevimab, and it's for those infants. It's ideal to have it be given within the first week of life, and most ideal is to be given in the hospital right after the infant is born, but it can be given up into the first week. But if they miss that opportunity, it can be given also up until 8 months of age if it's during that RSV season, which is great. So basically it's the antibody itself. So usually with vaccinations, sometimes it has like a protein or kind of a piece of a virus that's kind of made up in the lab that can't infect people. And then the body immune system sees that piece and then creates immunity. The body creates the antibodies itself to protect them. In the event that someone becomes infected by it, whether it's COVID, flu, RSV at a later date, that the body's ready and the person doesn't get sick or not as sick. But with the nirsevimab, just since infants are so young, their immune system's not very developed, so it's hard to use a vaccination for that. And so it's literally just like the antibodies themselves. And so, but yeah, so far it came out last year and it's been a huge success. Like you said, RSV is the #1 cause of hospitalization for infants in the first year of life, and has a huge impact on infants, on families, on healthcare system. And so they did some preliminary kind of studies and research about the first season, and they saw about like a 90% effectiveness in preventing that hospitalization from RSV, which is absolutely amazing. And it's going to make a huge difference for infants, for families, for hospitals, because I know, like, I'm also an ER doctor. We see a lot of these little ones come in with what's called bronchiolitis, but it's just really severe illness from RSV. And it's really scary as well. Like, kids have difficulty breathing. They're like working really hard. They're struggling. Obviously, their families are very scared. So having this type of immunization available for infants is going to be a big game changer. So, and yeah, at CDPH, we're working hard to make sure birthing hospitals in Chicago have access to this nirsevimab, particularly families that may be on like Medicaid or uninsured, underinsured have access, regardless of where you're born in Chicago. So that's been really important for us this season. And then, yeah, like you said, pregnant people can also get it towards the end of pregnancy, and so the pregnant person gets the vaccination, creates the antibodies themselves, and then those antibodies are passed on to the infant while they're still in the uterus, and then once the time they're born, then they have the antibodies all ready to go. So, yeah. A little bit more complicated than COVID and flu, where everybody 6 months and older can get them. But yeah, definitely talk to your healthcare provider if you're pregnant, if you have a newborn infant this season, or if you're 65 or older, about any of those vaccines and immunization products for RSV. So, yeah, no, that all sounds great. So, I mean, I know we've been talking a lot about vaccinations. Vaccinations are kind of our frontline #1 protection against a lot of these viruses this season. But we all know, especially after the pandemic, there's other things that people can do to protect themselves against getting viral infections and getting sick this season. What are some of those other preventative measures people can take this season besides getting vaccinated to protect themselves from viral infections?
Yeah, so that's a great question. So I think it's just the old school kind of thought. So staying home when you're sick, not exposing others. And then also, if you're not sure what your illness may be, like, so if you're having some of those classic symptoms of like sore throat, cough, fever, or runny nose, testing yourself to just confirm and see whether or not you may, have COVID or not. One thing that's a huge plus is that the federal government has relaunched their free testing program. And so you can request an at-home or 4 at-home kits to be sent to your house. The website for that is covidtest.gov. So encouraging folks, while that program is available, that you request that, because tests can be expensive when you try to buy them over the counter at your local pharmacy. So just having those tests ready and available if you need them, and still, wearing a high quality mask in crowded settings. So I recently traveled and, made sure I utilized a mask when I was, on the plane, just because we know it's that season and that time of the year where respiratory viruses are circulating. And I guess too, if people have any, questions about, any of these things, in terms of where to get vaccinated, where to, get, free tests, they're more than welcome to also call our CDPH COVID hotline at 312-746-4835. Yeah.
Yeah, no, that all sounds great. But yeah, especially this fall and winter, if you're in crowded areas, like you said, traveling either on a bus or a plane where there's a lot of people, wearing masks is never a bad idea. Or if you're just at at a mall or just like a big event with a lot of people, also not a bad idea to protect yourself and others. The big thing as well is obviously, like you said, when you're sick, stay home until you're feeling better, you're not having a fever. And it's also suggested those people that have recently been sick, once they're feeling better, going back to their daily activities, they should definitely wear a mask for 5 days just to make sure no lingering virus is getting out there and infecting other people. So and then it's great news about there's still COVID-free home COVID tests still available. So we definitely want Chicagoans to take advantage of ordering those. So and then obviously we know washing our hands frequently, particularly before. And I'm a big fan of hand sanitizer. Always keep it with me. So when I'm either getting into my car or go from a meeting or something where you're shaking hands with people or saying hello, just to kind of always keep yourself in your hands sanitized is not a bad idea. So I think we've covered a lot today. A lot of good information, a lot of amazing things going on this season in Chicago with CDPH and a bunch of different partners and organizations throughout the city that we're working closely with. So is there any last messages or items you want to cover before we close out for today?
Just encouraging people again to, visit us at our website again at chicago.gov /covidvax or our hotline at 312-746-4835.
Awesome. That's sounds like great message, great things to do. And I know we're just starting viral respiratory season, so I'm sure we'll be talking a lot more about this in the future. So please keep your eye out on our websites and social media for more information. But Jackie, thank you so much for joining me today. I think this was a great conversation. Thanks for all your great insight. We just want Chicagoans to stay safe this viral respiratory season. Please get vaccinated and stay safe and enjoy time with your family, friends, and the community. Thanks.
Awesome. Thank you.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.